I've performed over 1,200 lip lift surgeries, and I'm here to talk about the various complications that can occur with lip lift surgery and the things that we can do to help avoid them. First, let's talk about proper patient selection. Sometimes I get patients who ask about extreme types of lifts. Either they want the smallest possible amount of skin removed at the base of their nose to the point where it's difficult to even technically do that, or they're asking for a very large segment to be removed where it might become risky, both aesthetically and functionally for that patient. I think it's very important to guide patients towards a realistic idea of what's possible with lip lift surgery and not to oversell its potential. Another request that I sometimes get from patients is for perfect symmetry. They notice that some portion of the lip just doesn't look the same as the other side, and they want it to look completely symmetrical. But the truth is that with lip lift surgery, while we can sometimes adjust for some of the asymmetry, we're never able to correct all of it with surgery. Sometimes filler might have to be used to adjust some of the asymmetry, and sometimes it's just you have to live with the fact that one side of the face is always a little bit different than the other side of the face. In patient selection, we also have to be careful when patients come in with certain underlying medical conditions, and this can include things like uncontrolled diabetes that can potentially impact on wound healing, bleeding disorders that can sometimes thin out the blood and make it difficult to see what the surgeon is doing during surgery, and severe anxiety, which might make it difficult to perform this procedure under local anesthesia. But of course, there are options to perform a lip lift under IV sedation or general anesthesia. It's just something that is not as commonly done unless a lip lift is being performed in conjunction with another major procedure, such as say a facelift. Then the person might be under some deeper form of sedation. But for lip lift alone, oftentimes we're doing this under local anesthesia with just numbing shots, but we have to make sure that our patients can tolerate that. And there are some people with more severe forms of anxiety where they cannot lay there while a surgery is being performed and they're completely awake. Next, let's talk about bleeding that can occur intraoperatively but also postoperatively. To minimize bleeding, it's important to consider this risk and complication before even going in for surgery. Consuming vitamin K for about a week leading up to your procedure is usually a good idea for reducing the thinness of the blood. It's also important to stop many of the supplements that people take for at least a few weeks before surgery, because many of those supplements will actually thin the blood. And it also goes for the foods and drinks that we consume. Anything really spicy can potentially thin the blood, as well as alcohol consumption. So what you eat and drink in the days leading up to lip lift surgery really matters for optimizing the doctor's visibility so that they can perform the surgery as safely and effectively as possible. Now, for the day of surgery, it's important what goes into the mixture that's then injected into the area of where the surgery is performed, and that can include concentrated epinephrine that has the ability to clamp down on blood vessels to reduce intraoperative bleeding. Also, TXA or tranexamic acid is another substance that can reduce the thinness of blood and promote clotting within the area where surgery is being performed. Also, topically, something that I use quite often is oxymetazoline, and that is sometimes sold as Afrin, and you might know that as the nasal spray that's sold over the counter for both nosebleeds but also as a decongestant. Well, oxymetazoline can also clamp down on blood vessels, and when used topically on the area where we're working, it can be quite effective at minimizing bleeding. Also, there's cautery that's applied during surgery to buzz some of the vessels that might be bleeding. Now, I prefer to use a fine-tipped bipolar where you don't need to ground the patient and put a pad on the side of their thigh. Instead, you can use this bipolar device where the electrical signals go between the two tines, and that's quite precise and very safe to use during surgery, especially at lower energy settings. And also, something that I found that really helps with reducing bleeding postoperatively is the number of deep sutures that are placed during surgery. When I do lip lift surgery, I have a deep layer of sutures and I have a surface layer that's right on the skin. For that deep layer, I usually place about 9 to 11 sutures, and that keeps the area quite secure and it reduces that ooziness that sometimes can happen after surgery. Postoperatively, we usually apply a dressing on the area for about 24 hours, and we advise patients to limit the activity level for at least the first week to 2 weeks after the procedure. And that, of course, also helps with minimizing bleeding postoperatively. Now let's talk about another known potential complication and risk, which is infection. Any surgery on the skin, or any time you nick your skin, you open it up to potential infection. Again, there are ways to minimize infection risk with what you do leading up to surgery, and that includes doing something like a Hibiclens wash the morning of surgery or the night before, and that will reduce the bacterial load that exists on the skin. We also give an antibiotic by mouth within 1 hour of starting the procedure, and we continue that prophylactic antibiotic for about 3 days after surgery. We usually go with an antibiotic called cefadroxil or sometimes doxycycline. Before I start the markings on the skin surface, I like to use a chlorhexidine wipe, and that also is a strong form of antiseptic that will eliminate a lot of the little bacteria that might live on the skin surface. And of course, right before we're ready to start surgery, we use betadine to thoroughly disinfect the skin, not just the area that's marked out, but other parts of the face that are going to be within the sterile field. And within the last year, we've started to introduce prophylactic Valtrex or valcyclovir, which helps prevent against herpetic reactivation that can occur with lip lift surgery, or even after lip injections like with hyaluronic acid. Some people get herpetic outbreaks in the area. So we've seen a lower incidence of these post-surgical herpetic infections with the use of Valtrex in the day or two leading up to surgery. And of course, when we perform the procedure, it's performed sterilely. So that means properly washing the hands, using sterile gloves and sterile blue towels, and draping the patient appropriately so that we reduce the possibility of contamination. Post-operatively, once the bandage is removed from the incision line, I recommend that patients use polysporin for about 10 to 14 days. This is a topical antibiotic that will further help to reduce the possibility of infection. Some people can get a hypersensitivity to topical antibiotics, so we always have to watch for that, but most people can tolerate topical antibiotics quite well. And I always tell patients to avoid makeup or lotions that can potentially get into the incision or on the incision for at least 10 to 14 days after surgery. Really, when you start to feel confident scar gel, after you no longer have any fizzing, that's when you start to protect the actual wound, and you can put other types of topicals like moisturizer, like makeup, on top of the scar gel. The scar gel is going to be your base layer. So like SPF, various types of makeup can go on top of that scar gel. Now let's talk about the potential complication of scarring, and pore scarring that is, and what we do to try to optimize the appearance of the scar. Everyone gets a scar after lip lift surgery, but some people obviously heal better than others. And we don't want to just leave it up to the person's natural healing abilities. We want to do the right things to try to optimize their wound healing. And we have a whole video about wound healing and how it works and all the stages of healing and how scarring occurs if you want to learn more about that process. So during the procedure, I use a 15C blade. This is a very sharp blade that is used to incise the skin. Now, I don't use cautery to incise the skin because that could potentially mess with the edges of the skin. I think it's always better to use what we call cold steel to make incisions on the face rather than these kind of hot cautery methods of incising the skin. One way that we reduce pore scarring after a lip lift is to be careful not to curve the incision too high on the lateral portion of the ala, because that area tends to get more webbed scarring, and it usually doesn't help as far as lifting the lateral lip anymore. So I usually start and stop the incision where the ala goes from a horizontal to a vertical type of configuration. It's also important to be very careful with how the edges are handled and making sure not to buzz the little vessels that might be oozy right by the surface of the skin. It's sometimes tempting because you might have difficult visibility, but if you buzz too close to the wound edge, it sometimes won't heal in the same way. So it might be better to allow for more oozing if it's right from the surface of the skin rather than chase those little tiny blood vessels. As the tissues come together and close with the surface sutures, that bleeding will come to a halt anyway. And this is probably the most critical part in terms of minimizing the potential for poor scarring, and that's taking a deep plane approach to lip lift surgery, going down to the striations of the orbicularis muscle. So I'm looking at the muscle fibers, but I'm not cutting through them. I'm not messing with that muscle because we know that that can lead to various functional problems. So we don't want to necessarily cut into the muscle. Instead, as we get down to those muscle striations, we then create a skin muscle flap. So there's a separation between the skin itself, the deep thick element of the skin, separated from the actual muscle that lives beneath it, and creating that separation and chasing that down closer to the vermilion border, and then taking that skin and redraping it towards the base of the nose for closure is what I found to be the best approach to reduce the degree of tension on the wound closure, which usually leads to better healing. Another part of this to again improve the actual appearance of the scar is to place the deep sutures in a deep position. So I know that sounds odd, right? Because it's a deep suture. Why wouldn't you place it deep? Well, what I used to do in the very early days of my experience with lip lift surgery, and what I find many people do today, is that they put the deep suture too close to the actual surface of the skin. It's coming from a good place. They just want to bring the skin edges together. But if you strangulate that skin from the inside, then what happens is you build up too much tension, and that tension usually amounts to the appearance of these kind of vertical striations that you may have seen in some results, and usually that's not coming from the surface suture being placed too tightly. It's rather coming from the deep sutures being placed too close to the surface. So it's important to create that skin muscle flap so that you can then place those deep sutures in a deep position, minimizing the tension on the skin surface. And once those deep sutures are placed, the edges of the skin need to align very closely. What some people do is that they leave those skin edges misaligned after the deep stitch is placed, and then they try to adjust for that with the surface stitch. But that usually doesn't heal in as ideal of a way compared to making sure that that height is matched up as perfectly as it can be with just the deep sutures alone. And then you still have to come in with meticulous closure of the skin itself. And especially laterally where that skin gets thicker, you have to be careful not to mangle up that skin, but instead treat it carefully so that you're healing as optimal as it can be. And as I'm working, if I find that the skin is very thick, I might inject some Kenalog, which is a steroid, into the area as soon as the surface stitches are in. And that we found helps cut down on the incidence of hypertrophic scar, which is where the scar actually rides up above the surface of the skin. We can always inject steroids later, but sometimes injecting those steroids early on, right at the time of surgery, can be protective to some degree from hypertrophic scar. Post-operatively, in order to minimize scarring, it's very important to try to limit the movement of the upper lip for at least 2 weeks. So that goes for the foods that you eat. They should be soft foods, not using straws, being very careful with limiting animation of the lips. So for example, no crying, no laughing, no smiling. It's quite restrictive for at least the first few weeks, but it's very important as you heal up. Scar gel is a big part of all this, and we give patients our very own scar gel that you may have heard me talk about in other videos, our Feel Confident Scar Gel. And we've had thousands of patients now who've used our scar gel and others who've purchased it online, and they've done really, really well. And overall, it's been a great adjunct to optimizing the appearance of people's scars. Make sure to go to feelconfident.com to learn more about the specific scar gel and to see how it differs maybe from what other scar gels have as far as ingredients go. Sometimes post-operatively, if the scar starts to rise up, we might use Kenalog analog to help flatten that scar. And some people end up getting laser resurfacing of the scar to help buffer it and to help it look closer to the skin that surrounds the scar. I usually don't recommend early laser treatments. Most of our patients do not get laser treatments, but for the ones who do want that, I usually recommend they wait about 9 to 12 months minimum before going in for laser resurfacing. And the laser has to be picked carefully to properly match the patient's skin type. I usually recommend avoiding microneedling on a lip lift scar because in my experience, I've seen some atrophic type of scars where they start to dip down from microneedling. But even in the best of hands, suboptimal scars on the face are always possible. And that goes for lip lift surgery or any other surgery on the face. But the lip lift area has relatively thicker skin. This upper cutaneous area has thick skin relative to other areas like the cheek or the eyelid, for example, or even the area right in front of the ear that you'd see incised for a facelift. That skin tends to be thinner than this skin. So even after, for example, a rhinoplasty is performed, I used to do rhinoplasty lip lift combinations. The rhinoplasty scar will usually heal to a point of being imperceptible, whereas a lip lift scar does not always heal the same way, even in the same patient. So it's something to be aware of as you consider this surgery. Now let's talk about the potential complication of asymmetries. Preoperatively, it's very important to assess baseline asymmetry because all of us have some degree of asymmetry. So it's important to take good pictures, to sometimes I point it out to patients, to show them, hey, this side of your nose a little bit lower than that side of your nose, or, this lip lives a little bit higher, or you have more bulk of pink lip on one side compared to the other. Very important to tell people that because sometimes they think, oh, it was just caused by surgery. But oftentimes, if you look preoperatively, those differences were there to begin with. So it's very important to set proper expectations on what is achievable as far as potentially improving symmetry with lip lift surgery. And what I tell people is that centrally, I can usually get it a bit better. Like let's say the Cupid's bow is a bit higher on one side than the other side. We're usually able to adjust for that to some degree with a lip lift. But as you get out to the lateral elements, it's much harder to control that degree of asymmetry with lip lifts alone. And sometimes you need to come in with a corner lip lift. Or if you have too much fullness in like the pink portion of the lip, you might need to do a lip reduction on one side to adjust for the asymmetry. So it's not like just lip lift surgery alone is able to correct all asymmetry. That just doesn't happen every time. And also at the Cupid's bow, just to point out, oftentimes one peak is a little bit more rounded and the other peak is a bit more of a pointy type of shape, right? So trying to get those to look exactly the same with a lip lift is impossible because they have inherent differences in the actual shape of the peak and you cannot make it exactly the same from one side to the other. And these are minor points that most people would not notice, but of course I have a keen eye for detail, as do many of my patients. So we try to talk all of this out in advance for people to really know what's doable and what's not doable. So I'm all about just being upfront with patients about what we can achieve together with a lip lift procedure. And after the deep sutures are in, as I'm working intraoperatively, we can usually adjust for some degree of asymmetry if it's present at that stage. Now, of course, ideally your preoperative markings were able to adjust for that asymmetry, but hey, it's surgery and sometimes you need to make some decisions intraoperatively and some adjustments. But it's important to understand that there's swelling that builds up as soon as the initial numbing injections go in, and especially as we're working and manipulating the tissues during surgery. So you have to account for some of that swelling that's occurring as you go and try to adjust for some asymmetries that might still be there. So knowing what is swelling and what is just an asymmetry that needs further adjusting during surgery can be tricky and isn't always completely accurate. So I typically try to trust my preoperative markings, but there are times when I'll do some additional skin removal intraoperatively operatively, once the deep sutures are set, to further optimize that symmetry. Now let's talk about nasal changes. Many patients who go in for a lip lift are worried about how their nose might change. And, especially if they've had a rhinoplasty in the past, they are more attuned to the appearance of their nose and they don't necessarily want it to change with a lip lift. So it's important to discuss what kind of changes can occur, which of the changes are temporary and which could be more permanent. And the type of technique that's utilized for your lip lift will also change the potential risks that you might see as far as nasal base changes. And a lot of these changes are going to be temporary because the entire base of the nose is going to swell up with lip lift surgery, and it's going to take about 3 months for the swelling to gradually diminish. So I tell patients not to jump to conclusions about how their nose will settle after those initial months and to just give it time. Now, as far as the nasal base goes, where you make your incision will also dictate, what these different changes could be. So some people will make the lip lift incision go into the nose, right? As it enters the nasal sill, they'll bring that incision into the nose. What I find is that distorts the boundary between the lip and the nose and usually is not optimal, because what that does is that it flattens this area. So if you have a nasal sill, which most people do, it will essentially destroy that nasal sill and it'll replace it with just the skin tissue, which I think is not ideal. Rather, it's best to work along the base of the nasal sill and to only decide where to place that incision if the sill is absent. If it's present, then I work right along the base of that sill, and that is the location for my incision as I go from columella to ala. Intraoperatively, when I'm working on placing the deep sutures, I make sure to secure the area by the columella where there's good structure, and then I work on the lateral element where you have the ala, and that's also good structure, and I try to basically hang all of my tension points on areas that have good support in terms of the base of the nose. So we know the columella is well supported, the lateral ala well supported, and then the final deep sutures occur right at the sill where it's the weakest. By doing that, I minimize the degree of nostril show that can come about from lip lift surgery. Now, it doesn't mean that it brings it down to absolutely zero change for every single patient, but for most patients, it's extremely difficult to perceive after, let's say, 3 to 4 months have passed after surgery. And also, with the deep sutures being placed in a deep type of position like we talked about earlier, you're again reducing the degree of tension on the skin so that it doesn't tend to pull down as much. Now let's talk about maintaining proper function to the lip area with lip lift surgery. Lip lift surgery is performed for aesthetic purposes. It's not meant to usually improve too much on the functional side. So the last thing we want to do is to create a functional problem while addressing an aesthetic one. So some things that I find that are really critical to avoid would be messing with the orbicularis oris muscle, and that's the muscle we were talking about earlier. So staying away from cutting into the muscle, suturing the muscle in odd ways, that I think is really important to preserve function so that people can speak normally after surgery, after the initial weeks to months of recovery, and so that they don't have limitations of movement in the area in the long run. And it's important not to over resect the skin, because if you remove too much, then it might be difficult for people to close the mouth and to speak and to eat. So I usually plan to leave behind at least 7 millimeters of cutaneous skin in an unstretched position. Now, if you were to stretch that skin, you should be able to get to at least 10 millimeters of distance to consider it a safe amount for most people for functionality. Now, most people are left with more than that when it comes to lip lift surgery, but sometimes we start with short philtrums that people want further shortened for various reasons. Sometimes it's for the arch of the lip, sometimes it's for volume or to help expose their upper teeth more. So there are patients who come in and they start with maybe a 10 millimeter philtrum. We want want to make sure we leave them with at least 7 millimeters of skin when the skin is not on stretch, and typically closer to at least 10 millimeters when you stretch the skin out. But of course, every case is different, and we cannot just have one rule that works for everybody. So we need to understand people's preferences, and we need to see what will keep them safe from a distance and length perspective. And as with any lip lift surgery, there's always the chance of undercorrection, where we don't remove enough or not enough to satisfy the patient's objectives, or you can potentially remove too much. So always better to err on the side of safety.